Well, my name is Amdani Juma, and I do the work in Nottingham. I am the director for the African Institute for Social Development,
Okay.
which is an organization that is African-led that does health and skills. And when I'm talking about health, we do HIV prevention and support, and then we link to other diseases that Africans are disproportionately affected with. I'm talking about the mental health and cardiovascular disease and diabetes, things like that. But initially we did HIV alone, and now we're branching out so that we don't miss people with HIV and other conditions. We do link our work with the Nottingham Refugee Forum and other partner in Nottingham, like Terence Against Trust, and so on.
And how long have you been doing that work? When did you start?
Well, I did start 7 years ago. Initially I did work for the Nottingham Refugee Forum, and there were no HIV prevention work in Nottingham for the community. There were only support at the GE medicine. Apart from that, there were no any other work. So I was shocked as an immigrant asylum seeker coming from Africa. I expected some work to be done of that nature. So I did start wearing a red ribbon, which I still wear now, and I did start to do the photocopying of whatever is going around me, the Warriors Day event and stuff like that. And today there is a full-blown, HIV services in Nottingham, psychological support, the condom distribution, which we call the aware dresser. And we've got now more and more involved into the work of the NHS Nottingham City Clinical Commissioning Group, and we're branching out to the Nottinghamshire Clinical Commissioning Group.
Okay. So do you want to tell me a bit about the aware dresser? Because that's a really sort of unique way of engaging with the community, isn't it?
Yeah. The aware dresser project is condom distribution project where we empower the community through enabling them using condom appropriately. So at the African Institute we have identified ways to work with the communities, like African who have a pub, or African who have a restaurant, or an African who have a garage, depending on their clientele. So we do address the issue of condom distribution like that. So we will make condom available where they can just come in for any other service and pick the condoms. So we've got 23 shops, barber shop, garage and restaurant. And we also do, through the aware dresser, an outreach. 3 people from the African Institute will go around and will engage with people with our HIV prevention work, and then they will get an option of being given condoms. We also have people who want their condom to be posted to them, so that too is available.
Oh, that's really good. And so which communities are you working with in Nottingham? Because it's a very diverse city, isn't it?
Yes, Nottingham is a diverse city. We have a fast-growing African communities. In fact, last year in 2011, the statistics now reveal that the African communities have grown bigger and past the African Caribbean communities. So we've got a very rich diversity of the African communities. They're all new arrivals, so there are skills and health, skills for health and skills, general skills of integration that are still needing to be addressed. And that's the type of work that the African Institute is very interested to do, and we cannot do everything alone, so that's why we work with partners, we work with a collaboration of organizations have the funding to access these communities, so we become aware of accessing the communities. We have a lot of intelligence and the way to do it in a unique form by actually getting information from the community and using it for the community benefit. So it's all for community, by community, and done by the community.
Brilliant. And so what HIV message then do you find is really resonating with the communities, and do you have to deliver it a different way depending on who you're working with?
Certainly. Obviously the African people are an affected community of HIV and AIDS. They're living in a continent that has been completely devastated, and the information that they're coming with is in big part misinformation of like AIDS kill, HIV kills, and some of the African people suffered immediately by their own member of the community that died of HIV, so they've seen death and they've seen several people being buried, dying because of AIDS. So you've got to work from a very low base and actually suggest that there is a hope and that HIV is no longer a death sentence. HIV is a long-term manageable condition, and the majority of Africans do not have HIV. So there is a small minority that we are really interested in finding, and when we find them, then they know they can access free treatment. We did 4 campaign for free HIV treatment, psychological support, community support, and we've won. So from last year, in October 2012, HIV treatment is free regardless of immigration status. So it is in our best interest to get the community tested, and the minority that are infected by HIV to access treatment and live a long, normal, healthy and prosperous life.
So when you're going out, if you have 3 sentences or 3 simple things that you would say to people, in terms of the message and what you want them to do, either at an event that you're running or after, what are those 3? Or is there just one thing that you just say, do this?
Well, the messages that we drive in our events, which resonate with Africans, is you have come to this event, there's tests, so don't go back without being tested. We have an amazing response. People test, people queue to test, the same as in Leicester with LAS. So we are absolutely amazed by what the African people are coming forward for their health, and we've seen people testing, and we're so pleased with that. So the message that I could send to all Africans is, we can stop HIV in this generation. So start, we say it starts with me. So every African has an opportunity to start the process of stopping HIV this year.
Brilliant. That's a lovely message to finish with. Thank you, Andani.
Thank you. Thank you.